She's running for governor, and I'm ready to fill that spot. Thank you. So she's the only woman in the Pennsylvania congressional delegation.
Oh, really?
Yeah, that was to be my next question. You know who I am, I suspect.
Yes, I talked to you.
Did you do like grassroots organizing?
Yeah, my sign in the background. Yeah, my sign in the background. Yeah, my brochure. I told him I was
Yeah, all right.
now you get time. You're going to set it up. Maybe next week.
Okay. All right, this is good. Which background? Are you from around here? Or?
Yes, I've been in Philly for like 37 years. That's why I want to make it beautiful.
So if all you guys want to get your jackets or whatever you're going to do, we're going to go right across the street. It's directly across the street. If you want to do something here, if you can, I will have staff still here. But if you want to bring everything with you, that's fine as well. But I want to make sure everyone gets an opportunity to see some of the work that we've been doing in this community. Outside of the signage you see outside, we actually started to retrofit some of these buildings as well. So everyone wants to come along with me. We're going to make so if anybody we have food from Miss Denise. I don't know if she left me.
Yeah, she over there.
So we have some great food. Macaroni and cheese, yams, fried chicken, you name it. We have any and everything you might want. So with that, we're going to turn it over. You guys can mingle. We're going to start serving folks and enjoy. All right.
And right here because there because I see the Frankfurt sign where you're headed. Why not?
Open our doors to the 13th congressional candidate. I'd like to turn the floor over to her. She can say a few words.
Great. Well, thank you so much. It's so great to be here. Thank you so much. And I'm running because I believe in this community too. And I want to be able to take that belief and that passion from right here to Washington with me to work on things that are going to make things better right here in this community. My background's a little bit different than most political candidates. I've been a doctor in Philadelphia hospitals for over 25 years. And I wanted to share a quick story with you about a patient because it really sums up why I'm running for Congress.
Excuse me?
I am an anesthesiologist that takes care of pregnant women during childbirth, and that's where I spend most of my time. And I was down in Washington working on health care reform with the President in 2009. I'm very committed to making sure that everybody in this country has health care reform. And while we were fighting that fight, I took care of a young woman whose name was Sarah. And she was 19 years old, and she was pregnant, and she was in early labor. She was starting to have her baby about 2 months before her baby was due. And her story is different because she was born with a very, very serious heart condition. And as a baby, she had multiple surgeries to fix it, and she was very lucky, had been very successful, and she grew up, and she graduated from high school, and she turned 18, and she went off her parents' health insurance plan, because when you were 18 in 2009, if you didn't go to college, you didn't get health insurance. So she turned 18, she was working at a job that didn't come with any health insurance. She couldn't afford birth control pills, they're pretty darn expensive, and she got pregnant. And when she got pregnant, she didn't go to the doctor because she'd been told her whole life she had this terrible pre-existing condition and she'd never be able to get health insurance. So she just muddled along for as long as she could, and finally when she started to have labor pains and couldn't breathe anymore, she went to the hospital, and that's when I met her. And today, because of the work that I did on the Affordable Care Act, her story would be so much different. She could stay on her parents' plan until she was 26. She would be able to buy health insurance without any discrimination from having a pre-existing condition. She could get birth control pills without any out-of-pocket expense. Her story would be a very, very different one. And that's why I'm running. So we have better job opportunities here in the community, a higher living wage, a minimum wage that goes up, but we need a living wage too. We need an education system that prepares our kids for the jobs that are actually available here and gives them a much better grounding in just the basics of reading and making sure that they can compete in today's world. And we still need a lot of work on health care. Not only do we have a lot of people that still don't have access to good health care, we've got problems with quality in our healthcare system, and those are all things I'm very committed to working on. And we need to make our community stronger. We've got to reduce gun violence on our streets. I'm very, very committed to working on that. And the President's introduced a couple of really interesting programs that I want to see if we can bring right here. One is a promise zone, where they partner with local business to try to make communities stronger, public-private partnerships, get grocery stores into neighborhoods, better education. And also, the newest thing he's talked about is My Brother's Keeper, and I don't know if you've heard much about it. But again, it's a real partnership to give men of color clear pathways for opportunity in our communities. I think all anybody wants is a fair shot, that if they work hard and play by the rules, they've got a fair shake. And that's what I'm running to do, to make sure that everybody in our community has a fair shot. So thank you so much. It'd be great to have you.
All right. Those are individuals who push me every single day.